So I'm going to use the coronal view of a CT scan, so slices in the coronal plane front to back, to illustrate some points on an X-ray that might help things make anatomy more clear. So we've got the patient's clavicles. You can't quite see the spinous processes, but he doesn't look too rotated. But his trachea does do a little bend around what was the aorta. So the trachea bifurcating into right and left main bronchus. This is the top of the arch of the aorta coming down. His heart is here, and his right atria is over here. His ribs, the first rib at the back to the transverse process is there. 2, 3, 4, 5, 6, 7, 8. Less than 9 should be 9 and 10. So his volume on his left is reasonable, 10 and a bit ribs. On his right is a bit underinflated. His costophrenic and cardiophrenic angles are okay. On his left side, it's a bit blurry, and there might be a hint of air bronchograms behind the heart there. But there's also a distinct opacity in the right upper zone and a few other strange patches. If I embiggen this a bit, to some degree, you can see this almost looks a little structural, like some walls and voids. But yeah, it's not a normal pattern. But if we bring that into context, you've got the sternum in the middle here, and then the ribs coming off, the clavicle coming off up the top here. But if we look, there's these holes, walls and voids, so empty space and fibrotic changes around the lung. On his right, more so than his left, but a lot of empty space. So emphysema type changes in that the lung is too black, and they're holes like this rather than fine lung tissue. As we get further down, this is the there's contrast in this for a CT-PA, CT looking at the pulmonary arteries. So that would be the right atria, sorry, the right ventricle. And again, walls and voids, fibrotic changes. This is this kind of, call it an aero bar kind of look, but this holes and structural changes. And then this is like walls and voids of COPD type stuff. As we get further down, there is this big holes, cavitating lesions up the top and a big dilated airway. And the man has a past history of tuberculosis. So this is the big cavitating changes you get with tuberculosis. This lung actually doesn't look too bad back here, but maybe up the top is just walls and voids. And this is the kind of a slightly more normal fuzz of white pixels of very tiny blood vessels and capillaries that have blood in them as opposed to just air and empty space. So again, fibrotic walls and voids, the changes that you get with tuberculosis, and again over here, this very strange and thickened structures, and those kind of little honeycomby looking things, or aerobar as I think about them, and other structural changes. As we get to the back, we've got the vertebra at the back, which again we sometimes see back here. And as we get posteriorly further, you get, again, walls and voids and bull-eye type changes over here, all the way down, and this fuzz of blood vessels, and then the walls and voids in the bottom parts. So those are the ribs at the back, and then the ribs attached to the transverse processes as they come up, spinous processes, spinal canal. These are the scapulae either side. And then we get this structure here, which runs down the left-hand side. Here, this is the left of the vertebra, which is actually the aorta. And the walls of the aorta are very white and very calcified. So he's got hardening of his arteries, like calcium is literally the hardening of the arteries. This is the top of the arch of the aorta, this little aortic knuckle there. You can see calcification in a ring shape, which is slightly visible on here. And then calcification of the ascending aorta too. And here is the aortic valve, which also looks quite calcified. So that's what that is, calcification of the aortic valve. That's the left ventricle. The aorta looks maybe mildly dilated, but nothing drastic. And then coming down, so smoking history and lung destruction in emphysema, but also hardening of the arteries, which is another hallmark of vascular disease and coronary artery disease. Can we see an obvious coronary artery coming down here? Not with the contrast. So yeah, walls and voids of emphysema, structural fibrotic changes and big holes from tuberculosis, and calcified and hardened arteries from vascular disease from the smoking history.